Now, with the ICN's global recognition for nurses as a moving factor in healing the world, and by appreciating the true value of nurses in the healthcare, we now turn our attention to the nursing profession itself and how it sees itself as an influence of the global healthcare landscape. To position us in this thought, our next speaker is the head of Nursing and Quality, Psychological Medicine, and Older Adults Directorate of South London and Maudsley NHS Trust Foundation or Foundation Trust. He is also a member of the BAME or BAME Senior Male Nurse Network and an LGBTQ champion, a passionate advocate of Philippine nurses. Let us please welcome to talk about the nursing profession and its significant position in the global healthcare landscape, PNA UK's chair, Mr. Oliver Soriano.
Hi, everyone. Good afternoon here in the UK, and I'm very, very mindful that we've got colleagues in the Philippines listening in, and it's coming to near midnight. So I'm very pleased that you have stayed with us, and hopefully you can stay a few more hours to listen and be invigorated with the information that we're being shared. I'm truly honored, and I really don't know how to actually follow up what Ms. Yvonne Cogill's presentation is, because I know her for a fact, and she's been a mentor to myself, and she's passionate, and her wisdom sees us through to how we can be best as Filipino nurses here in the UK. What I wanted to share is as the interim chairperson of the PNA UK, just want to actually say thank you to our speakers, and especially to Lady, who actually managed to stand for us and share her experience, more so with the great speakers that we've got. Also, just to add, I've been in this country here in London specifically for the past 22 years. Been going through different positions, and currently I'm head of nursing, that's what JC mentioned a while ago, at the South London and Maudsley NHS Trust. So I cover the 4 boroughs of Southeast London. Probably some of you might know me. I've been teaching, or I was at one point teaching at Central Escolar University and in the Far Eastern University. To go straight to my presentation, I'm reflecting back when the program director of the first PNA UK World Cafe Convention approached me to actually give a talk. She asked me to actually present the topic on nursing profession and its significant position in the global healthcare. I was excited and equally daunted by the scope of the topic. Firstly, because of the depth of what the ask is in providing where we are now as Filipinos and within the nursing environment, and the impact that the nursing profession made locally, nationally, and globally. I have to say, and I have to admit, I'm no expert on global nursing perspective, but what I will share to you are my professional views and reflective accounts of what the nursing profession has put a stamp this year and for the past years. As well, I will be reflecting on the current climate that we are in at the moment, and look outside of what is it that PNA UK Philippine nurses can actually contribute on this global landscape. So I'll be sharing you my screen. Right, so the topic that I was asked to actually present today is about the nursing profession and its significant position on the global healthcare landscape. So it could not be more timely that the World Health Organization designated 2020 as the International Year of the Nurse and the Midwife. More than ever, the nursing profession and workforce has been credited on the courageous work, the humane and the humanitarian effort, as well as the strength and resilience in keeping the general population safe and healthy. And to quote the International Council of Nurses president, she mentioned that the nurses are in the spotlight, and all around the planet, this tragic pandemic is revealing the irreplaceable work of the nurses for all to see. What I thought of giving this direction is to look onto what we have done in the past 200 years. But like, I'm not gonna be giving you too much of that information, but just a snapshot of who our nursing leaders are for the past 200 years. So I would also like to pay tribute of our nursing leaders that paved the way and shaped how nursing professions evolved throughout the year. So first and foremost here is like Mary Seacole. She was born in 1805 and she became the unofficial nurse in Crimean War. So she was also credited for her role where war was taking, and she tended to the British soldiers. For her loving provision and care, she was loved by the soldiers despite her race. She was awarded Medal of her bravery and unselfish act. Then we know the one who is credited as the mother or founder of modern nursing. Florence Nightingale was also known in her work in the Crimean War, for which she emphasized that we as nurses should never consider ourselves finished nurses. She says that like we must continue to learn all of our lives. Other leaders that has been credited to kind of the development of nursing leadership is like Claire Barton. She's from America and the founder of the American Red Cross, and for which her travel with the Army ambulance during the American Civil War. She was noted in her humanitarian effort and acknowledged in providing care and comfort, seeing no difference of colors and of races. She was rightfully known as the angel of the battlefield. We also have Mary Eliza Mahoney, another first African-American nurse. She was instrumental in improving the status of Black nurses in the profession across America. She co-founded as well the National Association of Colored Graduate Nurses in 1908. Her work led her to be inducted to the American Nurses Association Hall of Fame, as well as to the National Women's Hall of Fame in 1976 and 1993, respectively. Elizabeth Grace Neal started the system of nursing registration. She got the privilege of helping drafting the bill aimed to protect the public from nursing malpractice in New Zealand. And this has become the world's first nursing registration act. We also have Edith Cavell. Is celebrated from saving lives of soldiers from both sides during the First World War without discrimination in helping some 200 Allied soldiers escape from the German-occupied Belgium. The next one is Mabel Keaton Stoppes, who led the battle to end racial prejudice in nursing, and she fought hard to finally and fully integrate Black nurses into the nursing profession in the US, and form coalitions both in nursing and the non-nursing communities. We also have Virginia Avenel Henderson. She developed the nursing theory, if people might remember their Nursing 101. And she was later known as the First Lady of the Nursing due to the impact and all her contribution to international nursing education, practice, and research, as well as its implication. Cicely Saunders is also well known as the founder of the St. Christopher's Hospice that takes care of the terminally ill patient. She is a renowned nurse, physician, and social worker. And you might know this person, Jennifer Louise Worth. She's a British memoirist, but also a registered nurse and midwife. She wrote the best-selling trilogy about her work as a nurse in midwifery, practicing in poverty-stricken area in East End, London. And one of her trilogy book was actually put into a TV series in BBC. You might have heard about Call the Midwife. Call the Midwife has been very, very instrumental to kind of like encourage more individuals to actually take nursing and midwifery. Moving forward, we got Eddie Bernice Johnson. She's an American, and she's the first registered nurse elected to Congress in the USA. Her nursing education led her to introduce the National Nurse Act of 2011, which recognizes the many contributions that nurses have made in public health and disease prevention. This was later copied in by different organizations and the same as different countries worldwide. Now, this year, I want to actually credit two of the people that I kind of like see as my instrumental guidance in the work that I do. The first is Dame Elizabeth Anyonwu. This year, she's been credited as one of the top 50 healthcare worker that is instrumental in the National Health Services. She was a life patron of the Mary Seacole Trust and set up Mary Seacole Center for Nursing at the University of West London, and has been inspirational to some of the nurses that I work with, and also with the younger nurses that's coming into practice. And last but not the least, the person that you've just listened to is Miss Yvonne Coghill. She's the former director of the Workforce Race Equality Standard, and I don't have to say anything else about her. And she's been so instrumental in supporting also the BAME Male Nurses Network that I'm involved with. As you can see that there's some spaces in here moving forward. And these are spaces that, like, maybe one of us, one of you, or one of the current nurses coming in together will be part of this legacy. I'm sharing this information at the moment because, like, this is where I want to actually look into where we are now. But, like, I want to actually share one of the quotes given by Maya Angelou, who's actually a author, a poet, and a civil rights activist. She said, as a nurse, we have the opportunity to heal the heart, the mind, the soul, and the body of our patients, their families, and ourselves. They may forget our name, but they will never forget how you made them feel. It has been instrumental when Yvonne was saying to us kind of like the people that she has worked with, the Filipino individuals that she's worked with, who's been very instrumental to kind of like give the vision of how BAME Network should actually be delivered. With this, I'm actually going to my second section, which is about where we are now. So where I'm coming in now is actually follow through to what Howard mentioned a while ago, because the first State of World's Nursing 2020 report reveals as much to celebrate about the nursing workforce. In partnership with the International Council of Nurses and the Global Nursing Now campaign, and with the support of governments and wider partners, provides a compelling case on the value of nursing workforce globally. Now, I'll be discussing just the few points that I thought that will be very relatable and visionary in this discussion. At the same time, there will be 10 actions that this paper have actually put forward. The first of which is that the global nursing workforce is 27.9 million, of which 19.3 million are professional nurses. This was an increase of 4.7 million in the total stock over a period of 2013 to 2018. Nursing is the largest occupation group in the health sector, accounting for approximately 59% of the health professions. Again, Yvonne Coghill, I've already mentioned this, much that like as the NHS here in the UK, we do have the biggest kind of like organization where BAME networks are actually represented. It also identifies in the World Health Organization's report that nurses are critical to deliver on the promise of leaving no one behind, and the global effort to achieve the Sustainable Development Goals, or what they call the SDGs. They make a central contribution to national and global targets related to a range of health priorities, including universal health coverage, mental health, and non-communicable disease, emergency preparedness and response, patient safety, and the delivery of integrated people-centered care. This is what nurses or the nursing profession is credited for. The third that I would like to highlight from the paper that the World Health Organization actually pointed out is like over 80% of the world nurses are found in countries that account for half of the world's population. And the world does not have a global nursing workforce commensurate with the universal health coverage and SDG targets. The global shortage of nurses, estimated to be 6.6 million in 2016, has slightly decreased to 5.9 million in 2018. But an estimated 5.3 million, which is 89% of the shortage, is concentrated in low and lower middle income countries, where the growth in the number of nurses is barely keeping pace with population growth. One of the things also that actually highlighted in the papers, like the aging health workforce patterns in some regions threaten the stability of nursing stock. Truly here in the UK, there's a lot of like nurses retiring at the age of 55, And this is actually impacting of kind of like having a younger workforce coming in. I'll touch later on about like what's the government, the national government in the UK actually doing to work on this one. And the minimum duration for nurse education is a 3-year program. This is majority of the countries, which is 152 out of the 157 responders, which is 97% reported. Also, I would just like to say that like 1 nurse out of every 8 practices in a country other than the one they were born or trained. So this was already shown to us by Yvonne a while ago, but I just want to emphasize that this is kind of like where we are at the moment. So you can see here in, in this table, where for the past 5 years, the increased number of nurses coming into the country. The international mobility of the nursing workforce is increasing, as you can actually see. Nurses coming from Philippines, from India, Nigeria, South Africa, and Zimbabwe. While the patterns are evolving, equitable distribution and retention of nurses is near universal challenge, and that's already highlighted in the speakers who have come before me. Unmanaged immigration can exacerbate shortages and contribute to inequitable access to health services. Many high-income countries in different regions appear to have an excessive reliance of international nursing mobility due to low number of graduate nurses or existing shortages, vis-a-vis with the number of the nursing job available and the ability to employ new graduate nurses in the health system. This is tantamount now of what we're seeing here in the UK. I would like to actually share to you a work that was done by Baker in 2020. It's highlighting that the NHS is composed of 200 plus nationalities. As of January 2020, you can actually see that there are 22,043 Filipinos working in the NHS. We are the 3rd highest self-reported nationality, of which 15,397 are nurses. So I'm sharing this information because like in World Health Organization paper, it will actually put some actions on how we can make sure that the equitability of the movement of nurses are actually looked into. So moving forward, a total of 82 out of the 115 responding countries, which is 71%, reported having a national nursing leadership position with responsibility for providing input into nursing and health policy. A national nursing leadership development program was in place in 78 countries, 53% of those who have responded. These are just few of the brave individuals that we can actually look into. And this is what the government and the national nursing leadership actually worked forward. So where are we now? On the paper from the World Health Organization, State of the World's Nursing 2020, there are 10 actions that governments, nursing leaders, and nursing organizations has to put forward. First one of which is the countries need to increase funding to educate and employ additional nurses. At least 5.9 million additional nurses are required, as what Howard actually mentioned a while ago with their findings. Additional investment in nursing education are estimated to be in the range of this number. Actions include review and management of national wage bills, and in some countries, lifting restrictions on the supply of nurses. This I'm mentioning because like I'm aware of what has happened in the Philippines when the ban of nurses to actually migrate. So this is in collaboration with other organizations that we're working with, so that like we can lobby in with the government in the Philippines of how we can support those nurses to start being deployed. Also, what's highlighting is like development partners and international financing institution can help by transferring human capital investments for education, employment, gender health, and skills development into the national health workforce strategies. Second of the action is that like countries should strengthen capacity for health workforce data collection, analysis, and use. Actions required include accelerating the implementation of national health workforce accounts and using the data for health labor. As well, having a collation of nursing data will require participation across government bodies. So it's not just the government, like also like the NHS Trust, private sectors to identify where are the strengths in their workforce. The third is like nurse mobility and migration must be effectively monitored and responsibly and ethically managed. So one of the work that PNA UK have been doing now is actually coordinating with the International Council of Nurses together with like the governments in the UK to actually lobby in of how we can ethically manage the migration of the nurses. Because at the end of the day, we don't want to actually have a situation where Philippines will actually lose their nurses. So we are aware as well that there's a lot of like graduate nurses in the Philippines who are currently unemployed, but like their ways of moving out is actually being deterred because of like the ban that has actually been done by the government. So actions needed here are to include in reinforcement of the implementation of the World Health Organization Global Code of Practice on the international recruitment. So this is what Howard mentioned a while ago: partnership and collaboration with regulatory bodies, health workforce information systems, employers, government ministers, and other stakeholders can improve the ability to monitor, to govern, and regulate international nurse mobility. Countries that are over-reliant, for example, the UK, the US, the Middle East, on migrant nurses should aim towards greater self-sufficiency by investing more on domestic production of nurses as well. This is a call by the World Health Organization to kind of like ensure that countries experiencing excessive losses of their nursing workforce throughout migration should consider mitigating measures and retention packages. Fourth is like nurse education and training programs must graduate nurses who drive progress in primary health care and universal health coverage. This is happening more and more in the UK, where we see kind of like graduate nurses taking master's courses, as one of our colleagues mentioned a while ago, Alex and Shallow, for example, and also taking PhD courses, because like the drive is for us to actually progress in like managing and monitoring the primary health care and universal health coverage. The fifth is like nursing leadership and governance is critical to nursing workforce and strengthening. More and more, probably you've seen that during COVID that like our chief nursing officer are actually more visible. She's more kind of like putting it out for DAME to be involved in the discussion, to be around on the table and discuss kind of like the concerns, the issues, and how we can actually improve the National Health Service. With this, planners and regulators should optimize the contribution of nursing practice. As actions include establishing and supporting the role of senior nurse in the government, responsible for strengthening the national nursing workforce and contributing to the health policy decisions. More and more that like maybe one of you or some of you are being involved in policy development and also discussions into it. This is where we can actually put our stamp into kind of ensuring that like we are being listened, we are being heard. So there are some opportunities by the other trusts to ensure that like people are being involved, like BAME are being involved and being listened to. And government chief nurses are also should drive efforts to strengthen nursing workforce data and lead policy dialogue that results in evidence-based decision-making or investment in the nursing workforce. 7 is policymakers, employers, and regulators should coordinate actions in support of decent work to ensure that like everyone's actually taking their break, having their kind of like equal pay. I think what we have to look into here is kind of like the action that the countries must provide in enabling environment for nursing practice to improve attraction, how they can be able to actually deploy and put retention and motivation of the nursing workforce. I think it's very kind of like mindful when Dennis asked Yvonne a while ago about how can we actually bring back those talented nurses to the NHS. Adequate staffing levels in workplace and occupational health and safety must be prioritized and enforced, with special effort paid to nurses operating in fragile, conflict-affected, and vulnerable settings. Remuneration is very important and should be fair and adequate to attract and retain and motivate nurses. Furthermore, countries should prioritize to ensure policies to address and respond to sexual harassment, violence, and discrimination within nursing. And I think we're nearly there. We're getting there because like more conversation about harassment, about bullying are being seen outside now. And it's quite good that like Yvonne actually showed us those data sets a while ago, highlighting where do BAME actually sees themselves with regards to harassments and bullying. 8 is that countries should strengthen capacity for health workforce, data collection and analysis and use. This is for ensuring that we are looking for information to reflect how we can actually better the delivery of care, the delivery of support that is given to the health workforce. The 9th thing that the World Health Organization mentioned as well is that countries should deliberately plan for gender-sensitive nursing workforce policy. Now, I'm highlighting this because like if you have seen on the first slide that I presented with regards to like nursing leaders, you might probably see that like, and think and wonder, most of the nursing leaders presented a while ago are all female nurses. So sometimes you always question, where are the male nurses here? I think this is the opportunity to actually like be more visible, be more heard, and to kind of like put the wisdom towards to kind of like identify what is it that we can do best. I'm sharing this information, like again, it's an information from the World Health Organization on the percentage of female and male nursing personnel. You can actually see the variation of how many female nurses as compared to the male nurses. So in Africa, you can see only 24% are male nurses. I think what we have to actually show here is that like countries should have the plan to be more sensitive about the gender workforce that they've got. Part of the government now that is doing and part of the work that the chief nursing officer have done is kind of like putting and mobilizing the BAME male nurses network, which I'm part of. And what we're trying to actually do in our network is to actually encourage more male individual person to actually apply for nursing. And if there are male nurses within their trust, each and one of them can actually reach out to this network for them to be coached, for them to actually be guided on how they can achieve their goal. So this is one of the things that like there's a big variation at the moment, as you can see. And the last action that the World Health Organization answers is kind of like collaboration is key. Philippine Nurses Association have been collaborating more, not just locally. And the global platform that, we're getting into is to ensure that like we are there to influence, we are there to actually hear the voices of our colleagues within different healthcare settings. So we collaborate not only within the Filipino community, but we collaborate also with our partner agencies. We collaborate with other networks of nursing organizations like the Malawian Nursing Organization, the British Indian Nursing Association, and the Nigerian Nursing Association. We collaborate as well with like different NHS trusts in the UK. We collaborate in a way to kind of like inform how the governments in each side to actually make sure that ethically the migration is actually happening and that the support that they're being provided is actually there. Collaboration is key on the work that we do in the Philippine Nurses Association because this is our way to actually influence, for example, the International Council of Nurses to kind of like hear the voices of the Philippine nurses. Truth be told, as what Yvonne mentioned, that kind of like we are in a position now that like some of the nurses who's speaking to you now have been in this country in the UK for the past couple of years. As already mentioned, I've been in the country for 22 years. It took my journey, quite a long journey for me to actually be in my position where I am now. But I'm hoping with the work of the PNA UK, we'll be able to actually coach, we'll be able to actually mentor and supervise any of those who will be part and member of the PNA UK, because that is the way that we can actually go up and be heard for the concerns, the issues, and the ingenuity and the wisdom that we can actually share in the National Health Service. With this, I just want to say thank you very much. And hopefully that helped to kind of like give you my topic about the nursing profession and its significant position in the global healthcare landscape.